somebody hand me a scalpel. Stat, we're about to cut into another episode of MB2 Underground. Podcasting ain't easy, but it's also not brain surgery. My name is Kiefer Commissara.
My name's Joe Fox. What am I supposed to say?
You're supposed to say Fox, Joe.
Fox, yeah, I didn't understand the
Did you
comma
ever
thing.
play Follow the Leader in elementary school?
Yeah, I don't think so.
Okay.
Man, the best intros, you do the best, you crush them.
This is how I'm telling you that I'm doing my research ahead of time.
It's incredible.
Because the goal is to seamlessly jump into the fun stories.
Gosh, yeah, this is incredible. How'd you do on the SAT, by the way? We haven't really talked about this much.
Why would we talk about how I did on the SAT much?
I'm just curious. We're about to interview the smartest individual we ever had on the podcast.
This is going to be very embarrassing.
I think we need to have our thinking caps on this one.
Okay. My SAT score was good enough to get me automatic acceptance into Texas State, but not good enough to get automatic acceptance into Texas Tech.
Okay.
Does that answer your question?
I think so.
So I took it again so that I could get automatically accepted into Texas Tech, and then I didn't go there.
Okay. Well, that's Texas Tech.
How did you do?
Lost. I mean, good enough. Yeah, good enough.
That's what I said.
All right.
Okay.
So we've got another awesome guest on the MB2 Underground podcast. This person has a master's in not only electrical engineering, right, from MIT, but also computer science. Right.
Yes.
So this is
what is electrical engineering?
Yeah, it's hard.
Got it.
Is what it is.
All right.
And so this person has super unique background. Really
MIT
incredible.
is what they talked about a lot in the Big Bang Theory, right?
I don't know. I don't watch Big Bang.
Okay, sorry. Go ahead.
It's where the smartest humans on the earth go to college.
Yeah,
and
Big Bang
grad
Theory.
school
Got
and
it.
Stuff. Yeah. Okay. So and this person, is the CEO of incredible business, Videa Health, that is utilizing the sexiest business concept that currently exists. And
We
probably
get it.
will
He's
currently exist.
smart.
No, I know, but it's like artificial intelligence, right? This is pretty cool, right? And a lot of like really cutting edge stuff. So anyway, without further ado, Berlin's favorite son, the CEO again of Videa Health, Mr. Florian Hillen. Welcome.
Thank you for having me.
Welcome.
Thanks for being here.
I feel like you shouldn't have said the thing about Berlin. I think it would have been more fun for all 6 of our listeners to guess where he was from based on his accent.
Yeah. It's slight, right? It's subtle.
Yes, very subtle.
Their ambition. Hey, man, again, thank you for being here. Really appreciate taking the time.
Thanks for having me.
Maybe to kick us off.
No, we got to start with the brain surgery story because that was my whole intro, and it's going to be weird if we let too much time pass.
I know. I was going to say. Well,
Okay,
can I
got
just
it.
ask before? Why did you go to med school?
Wow, such a loaded question. Why do you do what you do with your life?
Oh my gosh, when you put it like that, that is a loaded question. Way to go, Joe.
Yeah, exactly. Well, I mean, I do come out of a family of doctors.
Really?
My parents, my brother, all doctors. But I do love the healthcare space, right?
Yeah.
It is amazing to work with patients. I love the science behind it. I loved working with patients, and it's just like it's very easy to ask yourself like, what's the purpose? What you're doing, right?
Yeah,
when you're in healthcare, right?
Absolutely.
And that's why I got into medical school. And I loved medicine. Actually, funny enough, I dropped out after several years.
Yeah.
Shortly before my medical doctorate, and so my parents are incredibly proud, right?
Obviously.
Yep.
You made it a lot closer than we did, for what it's worth.
A lot closer.
I loved working with patients and improving health. I must say though, then several years in, I also realized like, wow, evidence-based medicine means that you are doing the same thing over and over and over again.
How monotonous.
Yeah, exactly. And I think that for many people, it's an amazing job, by the way. And if I would have had 2 lives, to say, then I would definitely be a doctor now. But you just have one, right? And so I felt like after several years, you do always the same thing. And I really love innovation, and I don't really accept rules that much. And I constantly think, okay, what else can you do? I know it's weird for a German, right?
I love it.
I'm like the anti-German when it comes to that stuff, as well as punctuality, by the way. So
So just Ms. Kiefer, when you go to Germany, I live
Thank
there.
you, because I have no context for the...
yeah,
So here's just like a little anecdote to help you understand. When you go to
Stereotype.
Germany, and you're not supposed to walk across the street because it's no walking sign.
Right.
Any other city
jaywalking.
in the world, I don't know about Japan, but any other city in the world, like people just walk, right?
You're talking about jaywalking?
Yeah, jaywalking. Yeah.
No.
That does not exist in
No.
Germany. The entire country. I mean,
It's
it's fascinating.
They look at you, they judge you so much. Like when I'm now back in Germany, I'm obviously doing it.
You're in New York?
Yeah, I'm now in New Yorker, like whatever. And they look at you as like you're the worst person on earth.
Yeah.
Like everyone stares you down, and it's like.
But if you're in New York and you're not jaywalking, they're
I
looking
know,
at you like you're the
I know,
worst person in the
I know.
world.
It's like you see how much context switching I have to do culturally. It's hard.
Yeah,
It's
that's
hard.
exhausting.
Yeah.
So Florian, tell us the story of literally the surgery story that you kind of had that moment. You're like, well, yeah, no, this isn't. This isn't for me.
Yeah. I mean, I was fortunate. Like I did a bunch of internships in hospitals, and one of the internships was in neurosurgery, and I got lucky that a very renowned neurosurgeon asked me to assist him in the surgery, and it was an open brain surgery. To be quite honest with you, for me, like the pinnacle of what I wanted to do, like literally like an open brain, and it glowed because you use like actually certain chemicals to see where the tumor is and so on, right?
Wow.
And
Epic.
yeah, it's one of these surgeries, where you are trying to get the tumor but nothing else, and otherwise they cannot count anymore, right?
Oh, I've seen Grey's Anatomy.
It's exactly that. That's Grey's Anatomy is 100% that.
Derek Shepard, he was a neurosurgeon. Continue.
Shepherd.
Right. Exactly. That's what I wanted to be.
You got the hair for it, man. What they call him?
I need more.
McDreamy?
That one was McDreamy.
Oh, okay. Got it. Sorry.
Oh, yeah, right.
Florian, I apologize.
No. And so I assisted in the surgery, and it was phenomenal. And then afterwards, there was an assistant doctor who's been like 38 or something like that, and he was in residency for over 7 years, and he told me, what you did today, I literally did the last 7 years, right? And for me, this was just this moment of like, I was like, this is great. Now let me do the surgery, right?
Yeah.
Which obviously I shouldn't do.
Right.
But
You're at 21 and without a medical degree, for
yeah,
sure.
exactly. Right. I was just a student, right, and so on. But I think that's also what entrepreneurs think, right? Like they probably they're always overconfident and so on, but you need that a little bit.
Absolutely.
But being a doctor is probably not the place for that, right? And so, actually the next day I kind of called my parents. I was like, I'm not sure if that's something for me. And that really started my journey of like thinking about quitting medical school. Up until this point, I was like, I want to become a neurosurgeon. I love healthcare, and I still love healthcare. But really this moment of this 35 plus person having done that for 7 years would have not been the right fit. And quite honestly, was the toughest decision in my life, but also one of the best.
Wow. Good for you for making that decision.
Yeah.
I'm sure very few people, actually follow through on something like that.
It happens later. To be quite honest, all of my medical school friends, like I think half of them at this point left the profession.
Wow. Are you serious?
But many years later, and many reasons is I believe while some also dentists or hygienists or something maybe don't enjoy their profession sometimes so much because 60 to 80% of their work is administrative work, right? Of sitting in a back office, typing out things, being compliant with regulatory, which all makes sense, but the job of there's not that much actually face-to-face interaction with the patient as much as there's administrative work. And quite honestly, that's part of why I founded Videa, to automate as much as possible and have clinicians spending more time with the patients.
Absolutely.
Yeah.
So, and we want to talk a whole lot about video as well, but maybe start with like how you came to the realization that like dental health has such a large impact on your overall health and wellness. Like, I mean, it comes off on your website pretty clearly that was kind of part of your founding vision and concept. Like, where does that come from? Because, I had to see some doctors when I lived in Germany, and there's a very holistic type of healthcare in Germany that I think is quite a bit different than the States. I don't know. Was that part of?
So true. Have you ever lived in Europe or?
Yeah, I lived in.
You lived in Germany.
Freiburg for
Yeah, we almost did the podcast in German.
Yeah, no, I
we don't want to.
Please.
Yeah.
Don't avoid it on my
I'm
behalf.
putting it on to test.
I'm already sitting here smiling and nodding. I can keep doing it.
But I spent a little bit of time, a couple of weeks in the German hospital, and it's a very unique, different than experience here.
No, I mean, so this all, I think this was born like, I'm always joking, like I'm made for this company. I mean, it was born actually when I left medical school. I calculated that if I would have become a neurosurgeon, I would have treated roughly 200,000 patients throughout my tenure. And I would love, I was thinking, okay, I want to have an impact in my life, as everyone says, right?
Yeah.
But I also worked for a consultancy at some point in my life, and they always said impact, but they never were like, what does impact mean, right? And so I love to quantify impact, and I wanted to touch as many people as possible in a positive way. And so my bar, quite honestly, and maybe that's my chip on the shoulder, if I'm honest, is I want to positive impact more than 200,000 people, because that's what I would have done if I would have not left med school.
Yeah, absolutely.
And so I was very fascinated with going into a domain in healthcare. Healthcare was for me always clear I want to be in that, where I can have a positive impact on as many people as possible. That was one aspect. The second aspect is then the quantitative or the qualitative aspect of what does positive impacting mean, right? And so I was in graduate school in the US. I was doing research in the intersection of healthcare and AI, and I was doing work on breast cancer detection, chest X-rays, and so different verticals, how you call it, in healthcare, right? And to be honest, it turns out that radiologists are actually pretty good. Because that's the only thing they do. I mean, I'm simplifying, but at the end of the day, if you've ever been there, they're in a dark chamber, they have $20,000 expensive monitors, right? And they go through every shade of gray in order to identify the tumor, which they should. And what we identified that in dentistry, a dentist really has 4 different jobs at the same time, right? They're a diagnostician, they're a surgeon, primary care physician, and a business person.
Yeah.
So for them, the diagnostic is just a small sliver, but it's important to get that right. And so why I became so excited about dentistry, and I keep being excited about dentistry, is of 2 reasons. I think AI and a dentist together, it's one of the few very clear win-win propositions. Yeah. It makes the job easier for the dentist, and it is good for a patient to get the treatment earlier rather than later.
Yeah, absolutely.
So there's a positive impact. And then the sheer amount of people we can touch.
Right.
We are right now already, so we have over 30,000 dental clinicians using our platform every day.
That's amazing.
Yeah, and we process over 50 million patients. Wow. So when we crossed the 200,000 patient mark, which is now a while back,
I'm done. I'm retired.
Our family chat was so guys, exactly.
I'm winning.
Yeah, exactly. Because every time we check in as a family retreat or something into a hospital, into a hotel, it's always Dr. Hillen, Florian. You know what I mean?
Florian.
Yeah, exactly. Because
this is so the Big Bang Theory.
Yeah, exactly. And so now I'm 15 million. Yeah, right. Where, how much did you do? But anyway, we have a very healthy family dynamic.
Yeah, not competitive even a little bit.
Not at all. Not at all. I also dropped out of a PhD, so you know what I mean. I have to compensate.
Doubly not a doctor.
Yes. Yeah, exactly. Doubly not a doctor. That's right.
I love
but yeah, so that's why I'm in love with dentistry, and then many, many other things. I love working with dentists. They're entrepreneurs. They're complex. They understand business. They understand patients. They understand the clinical aspect. It's such an interdisciplinary field. It's really, it became by far my favorite field in healthcare.
Wow. Well, tell us about the pregnancy app that you started, Neenu, right? Neenu?
Yeah, that's right. So, I didn't want to go into gynecology, but that's why dentistry is my favorite area.
You're already talking about breasts. Might as well.
For not having kids, I know a lot about.
I love it.
I know way too much about
what
pregnancy. I know a lot about pregnancy. So when that was actually I was still in med school, but that was after this moment about the surgery where I was maybe I should try something else. And so I was founding with a couple of my friends Neenu, which was a digital pregnancy app, and essentially. It was you could call it a digital pregnancy diary where every day, what's happening to your body and all of that. Now pretty much a standard, but we are talking now 10 years back, right?
Oh, yeah.
And then also we tracked certain symptoms and we were able, or we tried to prevent early pregnancy risks.
Yep.
Right? For instance, you get diabetes or you have an infection, which all leads to significant risks. And so that was a phenomenal experience to identify or to understand how to build products, software products. At this point, I was a medical student. I had no clue how this works.
So are you just between your classes, researching pregnancy? What symptoms tell me if I'm pregnant? Okay, put this into the app.
This guy's in med school. He's already been through the pregnancy class.
Oh yeah, I guess
that's right. I had but I like that story too. Yes, I was just on Google and I copied pasted. But a
makes
little bit
total
like
sense.
that. No, we had partnerships with universities and so on. My brother is now actually a gynecologist, but we had a lot of partnerships, and there was first a research project, and then we built the app, and then we launched it, and so on. And actually, in different ways, it's still used in Germany. And so that was an amazing experience to be like, wow, we can actually build products, which I didn't know what that is, right? Like, what is building a product? That was the first time I built a product, and I thought like, okay, wait, if you put a lot of work into this product, it can actually touch hundreds of thousands of millions of people, and that was just like at
And
that
hit your
point.
goal.
Yeah, exactly. And that's it. That was all. Yeah, exactly. And so that was the first avenue, and then I went to and then was like, okay, but Germany is an amazing place. And to your point, by the way, healthcare, dentistry, and healthcare is not split; it's all one.
Yeah.
Right. So I must say,
So interesting.
still to yeah.
fascinating? Yeah.
Also, just in a perception, right? Like besides like insurances, how they cover and all of that. I actually the first 2 years in med school are very close to dental students. So I did exams together with dental students. They had a better cafeteria, so we were always there.
For sure.
Yep. There's so many stories about that. But so it was a great experience, but it was also like Germany, especially back then, didn't really had this VC style, Silicon Valley style entrepreneurship. And so 2012, 13, I went to Silicon Valley to do an internship at Echo Health, which is still around. I'm still good friends with the founder there. And that was a stethoscope that analyzed heart sounds. So an electronic stethoscope, and it could predict and identify what kind of heart diseases you have. You probably heard about that, like different stenosis have different sounds. And that was the first time when I got in touch with AI. Back then, we called it big data and algorithms, right?
When was this? 2012,
2012, 13.
Okay.
Yeah, exactly.
Yeah,
So
interesting.
over a decade ago. And God, I'm old now.
I was just thinking the same thing.
Yeah, right?
Not even close, Florian. Get out of here, brother.
He was partying in Germany at that point.
Joe was already a grown up.
Ein Maß, bitte, ein Maß.
And anyways, and that was where I had my ChatGPT moment. Like, quite honestly, from that moment, I changed everything towards going into AI, or like we didn't call it AI back then, but that was actually the moment where I applied or like thought about. I mean, I didn't have the credentials at all, but like thought about going to MIT or whatnot to learn more about this.
Just by seeing that impact while you were there.
Yeah, it was huge.
That's amazing.
It was really. I still remember. I was just there 2-3 months, but those months was just like very impactful moment. Similar, probably to be honest, like probably this surgery moment and then this moment in Silicon Valley was like the two things together, which kind of shaped the rest. Yeah?
Wow,
That's awesome.
So tell us the birth story of Videa. Like, how did you actually do it?
So actually, wow, it's a perfect transition, because like at that moment I decided, hey, I felt like I understand healthcare a little bit, I understand the business a little bit, but I don't really understand technology. You know what I mean? How probably right now a lot of people feel like, what is this AI? And
Exactly.
I do feel you want to understand it from a first principle approach, like what's really under that and not just the output, if that makes sense. You know what I mean, right?
Yep.
Like everyone talks about it, but there's so much misconception about it. And so I feel like in your profession you should work on your strength, but I think education is sometimes good to work on your weaknesses. And so that's why I wanted to study computer science and went into Boston. And I knew I wanted to found something in the healthcare domain and the AI domain. And throughout my 2 years there, I was really like going through all the verticals. I was working in dermatology, in radiology, in biology, and so on. And was thinking, okay, where can I have the biggest positive impact on society?
Yeah.
I fortunately grew up in a way that, you know, I didn't care much about money or anything like that. I really cared about like, okay, what can you contribute, right? Anyways, and so back to what we talked earlier about, I think radiologists, they're actually really good. I think there's definitely a place for AI and we see the adoption, but I felt like in dentistry, so many things come together where you can support the diagnosis, but then support a lot of administrative things. And so I started doing research on it. And I published actually a couple of years ago then one of the first AI papers.
Wow.
I still remember there were like a lot of AI papers in China, but there were almost no dental AI papers up until this point. Now we are like one of the most cited.
How cool.
One of the most cited AI papers. Now dental AI is really a domain, but back then, like I still remember. Okay, I have to tell the story real quick. Karim Lakhani, he's a professor at Harvard Business School, and he was my we call it Dr. Father. He was my supervisor, right?
Did you say Dr. Father?
Yeah.
Okay,
Sounds
like Dr.
weird,
Daddy.
right? Yeah, exactly. I'm just realizing that this word works in German. It doesn't really work That sounds really weird in English, yeah. But
Yeah, Dr. Daddy, tell us about him.
Dr. Daddy, exactly. Oh God. But he was my supervisor. He worked with NASA on AI research projects. He's like, he worked with Microsoft and all these big things. And I came to him and I was like, I want to do AI in dentistry. And he was like, we are doing AI in rockets. Why do you do that? Right?
Yeah.
But then we found the results that we significantly improved diagnostic accuracy. We can identify decay almost up to 5 years earlier and all these cool findings. And we got really, really fascinated about it. And back then, I didn't want to found yet a company on that. I actually thought that this becomes my PhD.
Yeah.
So after I did master's, right, and then I was supposed to go into the PhD. I was in this PhD 5 days. I was a class of 2 people.
Again, that's longer than we were in our PhD.
Yep, much longer.
But my parents were like super happy. Oh, finally, there comes the doctor. I was 5 days
So
there,
close.
and then exactly. And then I realized, and we were a class of 2. There were 2 PhD students, and this was at Harvard Business School. And anyways, and after 5 days, I was like, no, I cannot do that. Like this was like again, I'm way too impatient for a PhD.
You're ready to go. You're ready to create this.
Yeah, exactly. And I realized also like it's about citations, but it's not about actually doing the work.
Mm-hmm.
Don't get me wrong, research is super important to all the
Right.
researchers out there. Really, there's a passion for that. But I was like, okay, I cannot do that. So I went into the room. I remember this with Karim, and he's a hotshot. He's really like a pretty powerful professor. And I was telling him like, he was like, okay, let's talk about your career. And he was like so excited. And you have to see they invest a lot of money into you. Like it's $500,000 they invest into you.
Wow.
And I was like, yep, I want to talk with you about that. So I joined as a PhD student and left with my first $100,000 check.
Wow.
So he wrote on the spot a check.
After
you
5
serious?
days.
Yeah, well, he decided that in 5 minutes.
Oh,
Yeah, I went into the room. He wanted to talk about my PhD career. I left the room having canceled the PhD, and he gave me a check of $100K.
I think that's
Unreal.
definitely Dr.
That is such a
Daddy.
cool story.
Yeah, that was, and then I was like, oh shit, now I have to actually do that.
Right.
Yeah, exactly. Because I didn't really think this through, to be honest with you. But now I felt like shit. Now I have a responsibility.
He's like, you better have thought it through.
And I had a little bit date, but I had actually nothing, to be honest. Like, I think about it, I didn't really have anything. No.
So what next? Then did you go out raise more money? Did you start putting that $100,000 to work?
No, actually, I didn't put it to work. I was like so anxious because he's like a friend. I actually didn't want him to invest. I felt like the pressure was too high. Like, you have to imagine, like, this was so much money for me, and I didn't want to spend it. So I didn't have even an account to put it. So I had to first found the company. And then I had to get a bank account, and I almost lost like the check and stuff. You know what I mean? Like, so I was like, "Shit, where's this?"
It's such a sweet story.
And then I deposited it, and that was it. I didn't pay myself any salary for many, many months, and like didn't touch it. What I did then is, to be honest, I printed out a HIPAA agreement on the internet. And bought on Amazon for $50 a hard drive, and was walking to all the dentists around Cambridge and Boston.
Amazing.
Wow.
I know all these dentists really well.
I bet you do.
And convinced them to give me their data. Yeah, that's literally how I started. Yeah, I went to I probably got data from like 10 offices or something like that, which was like 100,000 X-rays or something like that.
Yeah.
And then I was like, okay, now I have data. And then I started with a small team, which was part of the early research team where we did this research paper. So I mean, I had that, right? I understood this a little bit. Built the first AI algorithm, and but at that point, quite honestly, like we didn't know if the AI will ever be as good as a dentist, even
Right.
improve. Because all of this falls apart if the AI and the dentist together cannot be better than the dentist alone. Like this all falls apart, and we had no clue if we get there. And so that's how I started.
So what impact does your company have on dentistry now?
Well, I hope it starts to have a significant positive impact. I mean, that was the entire premise. If not, then shit.
Right. I owe somebody a lot of money.
Yeah, exactly. And otherwise, I really should have become a doctor. So, So what we have done, right? We've developed a platform called Videa AI, which is essentially like an AI-powered X-ray viewer, and we have over 34 FDA-cleared detection algorithms. So they identify cavities and bone loss and periodontal disease, endodontic disease, abscess of the tooth root tips, and so on, right?
So the FDA needs to approve your algorithm.
That's correct, yeah.
Wow. And the approval comes from showing them the research that, hey.
That's correct, yeah. It's very similar to, I don't know, like vaccines or whatnot. And we can I can talk about that for an hour, but it's like double-sided crossover studies. That's what you have to do. But one important thing actually I want to mention is that, again, there's a misconception. It's not the AI versus the dentist or anything like that. Yeah. You have to show in these FDA studies that the dentist, together with the AI, as like a collaboration, is more accurate in identifying, for instance, cavities than the dentist without the AI. And that's the bar. And otherwise, you don't get FDA clearance, right? And then you have to show. I have some anecdote. I think we had like over 1,500 statistical analysis in our latest FDA clearance. So it's like a ridiculous amount, right?
Wow.
Yeah. And so we showed that. And we did actually show, by the way, that a dentist with the AI identifies, for instance, 31% more true decay than without the AI, right?
That's incredible.
Yeah, it's really incredible. And I mean, a large portion of that is, for instance, early stage decay where you can still treat it with fluoride or whatnot, right? Or fillings which are missed, or where you think it's cervical burnout, but it's not. Like there are a lot of, and we have to prove all of that. Like they're very, very rigorous studies. And I think we are, my director of regulatory looked it up, and I think we are like the number 2 company in the world in terms of number of FDA clearances.
Unreal.
That's amazing.
Yeah, number 1 is Siemens, I believe. So
another great German company.
Yeah.
Wow, what a trip!
It surpassed them, but who knows? I mean, I think this is all hard to measure and all of that. But so we developed that as a product, right? And we have now over 35,000 or so, probably even more now. Much more probably now, but dental clinicians using the platform every day, as I mentioned before, and do like 15 million patients. And so, we work with large DSOs, right? Like Heartland Dental as an example. I mean, we work with MB2. We just announced that Dental Corp, which is a very large, the largest DSO in Canada, is rolling us out across their footprint. So we work with a lot of DSOs on rolling it out across the footprint because it enables them also to kind of standardize care a little bit, to have that, because you have to hire young dentists, and it's also a very good training tool right, for young dentists. And then also we have a lot of amazing partnerships. One of them is with Henry Schein, for instance, which you probably know. And they have Dentrix, right? And Dentrix is in tens of thousands of locations. And so our platform is directly in Dentrix. So if you have Dentrix, you can actually switch on Videa AI within 5 minutes. And so to your original question, what's our impact? I mean, we definitely process. Who knows, right? It's we process like 500 million dental X-rays roughly per year now.
That's insane.
But I hope the impact is, or actually, like we know roughly, that every second patient which gets diagnosed and treatment planned with our AI probably gets a different and hopefully kind of better treatment plan where we identify something earlier, or the patient most of all decides to get the treatment instead of delaying the necessary treatment.
Yeah. Right.
So our tool works actually a lot in just patient communication.
Yep.
It's a lot about like showing to the patient, hey, look, the AI also shows it. It's not me trying to sell you on something, but we see like a huge increase in case acceptance. That's how we call it, right? And that's where the big impact is. And so we know that actually in every second patient which gets diagnosed and treatment planned with our AI, they get a treatment which otherwise they would have probably delayed.
Wow.
And so I hope that's how we measure the impact in our company.
Well, and you were talking about how dentists have 4 different functions, and it's like you guys are plugging into each of those functions to help our clinicians be able to focus more on the clinicianing than all of the other parts of it.
That's right. Wow. So right now, really, and I think that's important. Again, it's like the AI with the clinician with the AI, right? And it's primarily, honestly, like a patient communication tool where we all have that. I mean, I'm a dentist, right? We go there and there's a gray blob, and you're like, okay, I should pay $2,000 for a crown. It's very hard to communicate that. Our AI
it doesn't hurt yet. Or
exactly, it's asymptomatic.
It's just a blob,
well, I always had that.
That blob's always been blobbing.
Exactly. And so we do all of that. Like we automatically can show how far the decay in the enamel dentin pulp is and so on. Wow. So we can communicate the treatment plan just much better. Or for periodontal disease, We know 49% of Americans have periodontal disease, which necessitates treatment. The average treatment planning of the average practice is roughly 9% or something like that. So you see there's like a huge gap, and that's bad for all of us because you mentioned earlier, it impacts diabetes, hypertension, and so on. So for instance, our AI like automating measures the bone loss, right, at Videa AI, and it gives like green, yellow, red, right, if it's over 4 or 5 millimeter or if it's just 2 millimeter. And that's a very effective tool to show to the patient. Exactly.
Yes.
Exactly.
Yeah.
In my company, by the way, like we have this, we have a Google map where you see all the thousands of offices who use Videa AI, and almost every zip code has no one. And so we reimburse you in our company when you go to a dentist, and it has our AI. So that we have a value which is called customer obsession, so that we understand how it works. And so I'm going to a dentist all the time with our AI and everyone, and we come like, it's gamified. I know exactly how many millimeters I have, and I'm flossing like crazy, guys. I'm not increasing that bone loss. You know what I mean? So that's kind of how it works. But we hope we can automate a lot of stuff differently, because I think, quite honestly, no one enjoys being in the back office and writing claims and charting existing treatments and whatnot. I think hopefully we can automate a lot of the administrative work next.
Yeah.
So the clinicians can spend more time spending with the patients. Quite honestly, that's why I left med school. So
You're like, so we're doing it.
Exactly, right. Yeah.
How does Videa stand out against the competition? How are you, like, what's the different value add for the clinicians compared to others? Like, what else is out there?
Yeah, I mean, I think there are like 2 other players, right? And I think what we focus on a lot is actually the dentist. So we don't work, for instance, with insurance companies on fraud, waste, and abuse.
Yeah.
We do work with insurance companies on getting your claims paid faster, but we don't work on fraud, waste, and abuse because we feel like, and there was an intentional decision a couple of years back, it's hard to get money from insurance companies to reduce the payouts and at the same time be on the provider side. So we are very, very focused on the provider side, right? And then we are focused all on better care. So everything what I mentioned earlier, our entire product is designed about easily diagnosing, but then also showing it to the patient.
Yep.
And so, for instance, we have a diagnostic view, which is for the dentist, and then we have a patient view.
That's awesome.
Which is
That's
for the
cool.
patient, where you color it all in, but then also we show the intraoral exam, and you can even print it out and send to the patient afterwards. So we are very much dentist or dental clinician focused, if that makes sense. And so I think
makes total sense. Yeah.
Exactly. Where we stand out, we have just a much, much higher adoption, meaning like it's much easier to use our product. And we just see that the rate of how often our product is used across the patient population is very, very high. That's why a lot of DSOs, I mean, they do bake-offs. That's why we usually win.
Yeah.
And then the second thing is obviously that if you have, for instance, Dentrix, it's just a no-brainer to use Videa AI because it's not a separate window, it's not a separate product or anything.
It's
exactly,
embedded.
it's just right in the PMS system. And I think, again, going to the mission, we don't want them to spend more time or going out to a different product and so on, right?
Using multiple platforms.
Yeah, exactly. It's hard.
What you guys have done is incredible. Congratulations.
Thank you. Thank you.
Yeah, absolutely. What do you think dentistry looks like in 10 years? I mean, you're clearly able to see the future. Like, what does it look like?
10 years is far out. But look, I do believe that in the next 2 to 3 years, clinical AI becomes the standard of care.
Really?
I think we are close to the tipping point, and I think we will reach that tipping point next year, where so many dentists have adopted solutions like Videa AI, or in Dentrix, it's called Detect AI, that every dentist knows another dentist who has it. So then, you know what I mean? Then it's a community. And then I believe, and we're seeing this already, that patients will actually request that as well.
Absolutely.
We have more and more patients reaching out to our website.
Interesting.
Asking if their dentist can use Videa AI.
Yeah.
That's cool.
Exactly. So I think that will happen in 2 to 3 years. I think in 5 years, I think the majority of administrative work will be automated, which I think is a really good thing because it's just not fun. And to be honest with you, I think in 5 years, maybe earlier, we will be at a point where we can predict what's going to happen with diseases. If you don't get a crown now, what will going to happen in 6 or 12 months?
Not just your oral health, but your
exactly. Yeah,
it's a whole different level of preventative care.
Yeah,
that's right.
So cool.
And that's you mentioned this earlier. That's where I honestly really want to drive it. That's why I named the company Videa Health. It actually comes. Videre means to improve.
Yeah.
to improve
Obviously.
overall healthcare. Yeah, exactly.
Mm-hmm.
Yeah, she told me that earlier. You were like, that was Latin, right?
Yes.
Yeah, exactly.
You read your notes. Good job.
No, that's fantastic, man.
And to predict, ideally, I would love to have dentists, and I think with AI we can do that. That dentists become like kind of the filter for primary care physicians. A lot of people go to the dentist, but not to the primary care physician. And right now in US, 4 cents on a dollar are spent on oral healthcare. 96 cents of a dollar are spent on healthcare.
Wow.
And of the 96 cents, take out cancer.
Yep.
The biggest buckets are hypertension, diabetes, and Alzheimer.
All things
wow.
Exactly.
that oral health will.
That's right. Imagine we could equip dentists with early flags of like, hey, your patient has a high risk of diabetes based on the gum and all of that.
Yep.
Please send them to a primary care physician. I believe that there will be not medical dental integration, but dental medical integration.
That's fantastic.
And that's what we're working towards. That's why, literally, that's why I named the company that way.
Wow.
That was a manifestation.
Yeah.
This
Well,
is
it will
what's gonna
take
be.
it takes a little bit longer time, but I'm patient.
Yeah.
Not really. Yeah,
Yeah.
exactly.
Not what I'm gathering.
It will happen. That's why it will happen. Yeah.
It is exciting though.
Yeah.
Super exciting. I mean that's another awesome trait of an entrepreneur, right? You can literally see the future, and that's clearly what you've done. But yeah, I've never heard anybody lay it out like that. That's profound. That's special.
Yeah, I mean that's one part of it. I mean it's much more complex than that, but that's part of also why sometimes healthcare costs in other countries are lower, right?
Wow.
Right.
And I hope that that's what we can achieve. Again, imagine we can increase the 4 cents to 6 cents, but reduce the 96 cents to like 80 cents.
Yeah.
Because the biggest problem with these chronic diseases is that they are caught too late and then becomes exponentially more expensive.
Yep.
Yeah.
Right? And that's not great for any one of us. Every one of us should get periodontal disease treated.
Yep.
Because you have bacteria which can go into your entire system. But a lot of don't have that treatment, right? So we are getting there. Yeah.
This
That's
is
fascinating.
fascinating. Hey.
Yeah,
Did
my
you just
bad.
steal my word?
F word. Go ahead. Sorry.
No, I was
Florian.
going to say this is really cool. Thank you so much for coming out here and doing it. I know it's a quick trip for you, but this has been fascinating.
Yeah.
Yeah. Thanks for having
Is
me.
there anything else that we didn't cover you want to talk about? Or?
No, I mean, I think like just to listeners, I would just, I feel like there's a lot of uncertainty about AI, right? Like it's crazy how ChatGPT and how much it will impact our lives. And I think there are some situations where, you're not clear, is it great or not, right? Like there are like customer success, right? Their jobs will be lost or are already lost. I think what I love about Dentistry and why I chose to build that company is because it's really a win-win proposition. You know what I mean? There's like, it helps the patient, it helps the dentist. And so I wouldn't be scared. I would just try it out and learn about it.
Love it.
That's fantastic.
Awesome. Thanks for having me.
Yeah,
Thank
we
you
really
again.
appreciate being here.
Thank you.
Awesome. Listeners, thank you for joining us for another really, really fun, exciting, interesting episode of the MB2 Underground podcast. We'll catch you next time.
Keep it cerebral, my people.
Wow.